As of Monday, there are now 875 confirmed cases of the new coronavirus in all of Maine's counties, according to the Maine Center for Disease Control and Prevention. The statewide death toll rose to 35 on Monday with the death of a woman in her 70s from Waldo County. So far, 138 Mainers have been hospitalized at some point with COVID-19, the illness caused by the coronavirus. Of those, 39 are currently hospitalized, with 16 in critical care and 9 on ventilators, according to the Maine CDC. Meanwhile, another 414 people have fully recovered from it, meaning there are 426 active cases in the state. Here's the latest on the coronavirus and its impact in Maine. The Maine CDC will provide an update on the coronavirus later today. The BDN will livestream the briefing. A person who stayed at the Hope House shelter in Bangor has tested positive for the coronavirus, according to the shelter, marking the first reported case among someone who accessed the city's homelessness services. A new model predicts that both Maine and the nation likely have a couple more weeks before coronavirus deaths will reach their peak and start to decline. The projections by the University of Texas at Austin set out the probability of a peak over 3 separate time frames. In the most likely scenario, there is a 75% chance that deaths will peak in 2 weeks in Maine. That estimate from the University of Texas at Austin came as hundreds gathered in Augusta on Monday to protest Democratic Governor Janet Mills' orders to close non-essential businesses, to ban gatherings of more than 10 people and to ask that Mainers restrict trips outside their homes whenever possible. Some protesters wore masks, which organizers had suggested as a way to signal willingness to comply with social distancing guidelines, but many lined the corner of Capitol and State Streets in close proximity as cars drove between the governor's mansion and the State House. Similar protests have been held in other states. By staying at home and following social distancing guidelines, Mainers appear to have slowed the spread of more than one respiratory virus. Growth in the numbers of diagnosed influenza cases and flu-related hospitalizations has slowed substantially since mid-March, when restrictions on public gatherings and business operations began to roll out. While colleges and universities around the country plan for the possibility of a fall semester without students on campus, Maine's public universities are preparing for students to return for fall classes. That's not to say campus life would look as it did before the coronavirus pandemic. The University of Maine System is preparing for face-to-face instruction as long as group gatherings and interactions are permissible and advisable by the end of August, according to a spokesman. A subsidiary of Westbrook-based IDEXX Laboratories is in the early stages of producing a coronavirus test for humans.